This is Ken Bradford, Assistant Superintendent with the Office of Career and College Readiness here at the Department of Education. This morning, we are going to present with you our school reopening resources for 2020, 2021. The way that we will facilitate the Zoom session this morning is State Superintendent Dr. Brumley will come on and he'll give some opening remarks. Then we will transition to Dr. Welch from the Office of Public Health, who will give us an update on COVID-19. Then we'll come back to Dr. Brumley, who will guide us through and facilitate the slides on the reopening resources and the public health guidelines. Once we get through those, we will pause and then we'll go into a question and answer session. So at this time, what I would like to do is ask everyone, if you do have your videos on, if you wouldn't mind, if you could please turn those off to save any bandwidth. As the presentation is ongoing, you can submit your questions. They will come to me as the webinar host. What I will do is I will group like questions, and then I will moderate the question and answer session with Dr. Brumley and Dr. Welch at the end. So at this time, Dr. Brumley, I will turn it over to you for opening remarks.
Thank you, Ken, for that, and thank everyone for being on the call with us today. This is definitely unprecedented territory for all of us in the education space, but knowing many of you and having heard of the talents of many of you, I think that we will work together and we will get this done for children. I know that there are many reasons why we can't get this work done. I know that there are many barriers. I certainly know that there are challenges, and there are so many things that are just unknown. But I also know that as a passionate educator, we have to find ways to do this for kids during this global health pandemic. We have to find ways to safely reopen our schools for our students and our employees, but simultaneously we have to find ways, no matter what ends up happening with this virus in the phase that we may or may not be in, that we provide an education for students. And so that's going to cause us and prompt us to have to operate with innovation and urgency and creativity in ways that we have probably never worked before in order to get this done. I do not come to this role without an understanding of many of your roles, having served as a classroom teacher, having served as an assistant principal and a principal and an assistant superintendent and a superintendent in two distinctly different settings. So the questions that you've been asking, the questions that you've been wondering, I too share those questions and those concerns. And we've tried to, through this process, answer as many of those questions as we possibly can. But I'm also sensitive to knowing that the state of Louisiana can't put out a one-size-fits-all plan that will answer the nuanced questions of every LEA. There are differences throughout the state in the way that you operate and how you operate and how you have to operate. And so what we attempted to do in conjunction with the Louisiana Department of Health is put forward a plan that contains guidelines, which are things that you really must do, and then best practices are things that you should do or should consider. We will roll out base level of that plan for you today on this call, but certainly over the next few days that will continue to evolve, and we will populate our website with additional information over the next few days and throughout the course of the time while we are educating through this pandemic. Our information that we share with you in the plan today will be based on phases. So you will know what are the guidelines and best practices if the state of Louisiana is in phase 2, what those look like if you're in phase 1 or phase 3, because there could be a situation where we do have to toggle back and forth between phases over the course of this school year. And so I look forward to sharing this information with you. If you are looking for a silver bullet, you probably are not going to find it in this particular plan. What you will find are strong guidelines to help you make decisions at the local level to take care of the needs of your community, your employees, and your students. And again, I'm very sensitive to how that looks different from place to place, but I'm also very passionate about the fact that we have to safely reopen and we have to make sure kids get an education they deserve. So Ken, that's going to wrap up my introductory comments. And I know we want to turn this over to Dr. Welch before I come back on and share that plan with the group.
Yeah, thank you, Dr. Brumley. Dr. Welch, at this time, I'll turn it over to you to provide us an update on COVID-19.
Ken, I just want to make sure you can hear me.
Yes, sir. We hear you loud and clear.
Okay, excellent. Thanks, everybody, and thanks for having me. And first, I would like to acknowledge all of the work that LDOE has done with the Office of Public Health throughout the last 4 months to help understand, deal with this pandemic, from closing schools all the way at the beginning to working with daycare centers and summer athletics and summer activities, and now planning for the fall. And just understand what a difficult challenge it has been with this particular virus, where the whole point in prevention is keeping people apart from each other, whereas in the educational environment, a lot of what our goal is to safely and effectively put people together. I just want to acknowledge how much work has gone into these guidelines. Secondly, I would like to say that this has been very serious for Louisiana. I'm sure everyone who watches the news, we have more than 50,200 confirmed cases of coronavirus in Louisiana, with more than 3,000 deaths. And we all certainly understand that that is an underrepresentation of what has happened. Many people who get this disease, there's a range of illnesses all the way from relatively mild, or people don't even know they have it, through mild illness that looks like a cold, through more serious illness that looks like the flu, through even more serious illness that looks like something that people need to go to the hospital, maybe be hospitalized, maybe need an intensive care unit for, and then unfortunately possibly even die from. So there is a wide range of illnesses that may present. We do know that there are certain illnesses and risk factors that that put people at greater risk for these more serious complications. Those include the older you get, and then other comorbid health conditions like diabetes, like immune suppression, like high blood pressure, obesity. Those things put people at higher risk of being more at risk to be one of these people who has a serious out from coronavirus. Now, a little bit of the serious, the silver lining with this is it tends to not affect young children and young adults nearly as serious as it affects other people. And that's really good news. Children tend to do very well unless they have another one of these comorbid conditions. They tend to not get as sick. But what we don't know is what role children will play in the transmission of this virus within our communities and to these more seriously ill people. And that's the real challenge here. You all remember that the very first thing we did when this got really serious was close schools, and that oftentimes has kept children separate from each other. Now that we are slowly reopening, we've made it through phase 1 and now we're in phase 2, children will start to regroup in slightly larger groups, with restrictions, fortunately, but we just don't know what role children are going to play in the transmission of this disease. And that's why it's still very important to keep these guidelines and keep these precautions in place so that we can make sure that the state of Louisiana, the healthcare system, can cope with the current rate of illness, and then hopefully within the months to come, find an effective treatment for this disease, and then hopefully a vaccine. Once we get to that point, we can, quote unquote, go back to normal after that, which is all what we're looking forward to. So I just want to acknowledge all of the work that LDOE has done, state that this is just temporary. These are pretty serious restrictions to have to undergo, but it is temporary. And again, the goal is making sure we save people's lives. So thank you, Ken, and I'll be here on the whole webinar to answer questions that are appropriate.
Thank you, Dr. Welch. Thank you, and also we to say thank you to our partners at Children's Hospital, Children's Hospital of New Orleans, who are on the call today, who has also helped us in our discussions and in developing our guidance. So at this time, I'll turn it over to our state superintendent, Dr. Brumley, who will talk about our resource development process and walk us through the resources.
Thank you, Ken. So we have worked collaboratively with the Louisiana Department of Health on this plan, and particularly around the guidelines, which should be considered things that systems must do. These are things where we have worked extensively with the Department of Health to make sure that they feel good about outlining these guidelines for local school systems in order for them to be able to open and then operate. So that collaboration has happened over the past month, and certainly over the last couple of weeks has intensified as we've begin the process of moving closer and closer towards the launch of this plan. And in fact, on Friday, we even had a last minute meeting with Department of Health officials, including Dr. Guidry and Dr. BU, to finalize some of the information in the plan. We also have had participation in the SREB reopening task force, and we've been represented by Ms. Sandy Holloway, who is our BESI president, as well as Mr. Ken Bradford, who is assistant superintendent here at the department. There's been consultation with Superintendent's Advisory Group, which met several times discussing the health and feasibility concerns of the plan. And also outside of that advisory group, there's been conversations with various school leaders. We've had extensive deliberation with and direction from a 20-member public health response team, which culminated in the final approval from Louisiana Department of Health state officer and assistant secretary. And that team are really experts in this virus, epidemiologists, public health officials, and then, of course, representatives from state agencies. We also recognize that while they are experts in the virus, school leaders and educators are going to be the experts in how we actually operationalize this plan in your individual school systems. The plan has been reviewed by the Resilient Louisiana Commission, the K-12 subgroup, and adopted by the Education Workforce Development Task Force and the full Resilient Louisiana Commission. So this plan is a product of significant feedback and guidance from a number of different organizations, and it leads us to where we are today. So we are going to provide several resources of information, and they'll be broken down in the following ways. So, and I think vocabulary will really matter for us moving forward. We have to make sure that our vocabulary is consistent. And so these next two bolded phrases will be really important as we go into reopening and as we operate during the school year. The first being guidelines. So those are Department of Health baseline public health requirements for school systems to follow when reopening school facilities for this fall. So whenever I think of guidelines, I think of things that I must do. If I'm going to operate my school, if I'm going to maintain our school, these are things that I must do. And these are things that the Department of Health has signed off that are things that must happen within a school system for the school to open. Next are a set of best practices. So best practices are just going to be supportive guidance and resources for implementing these guidelines. And so they will be supporting you, supportive information to hit the guidelines, but it will also be additional things that you could consider as you reopen your school year and as you work your way through the school year. We'll provide you with a planning template and checklist. This will be a template with questions to guide your school systems in planning for reopening, with an accompanying checklist for reopening. And we are going to ask so that we can in turn provide technical assistance back to local systems and in concert with public health officials here at the state office. We are going to ask that school systems submit their plans on a number of different items back to the LDOE so that we can help support you in your reopening processes. We will also have a FAQ document and I'm certain after this release of this information to all of you today, you will have additional questions. What about this? What about that? How do we do this? And that's natural, and that's to be expected. And so as those questions roll in, that will populate an FAQ document that we will keep on the website that will be live and in real time, hopefully answering many of the questions that you have. And be mindful that as there is no playbook for this, we will have to find answers oftentimes on how to answer some of the questions that you may have. We wanted to flag a few supports from key partners, and this is certainly not an exhaustive list or a complete list. I know that many of you have supports from key partners in your local area, but Children's Hospital New Orleans Hotline for School Wellness and Virtual Care, you have the number there, offers guidance to school nurses and school administrators for medical questions pertaining to students or team members, and facilitates virtual care visits or enrollment in home monitoring for those in quarantine. You can call that hotline between those hours on those days. Also, Children's Hospital of New Orleans will be hosting a town hall series for school. These will be conducted every 2 weeks through July and August, and will provide update information on COVID-19, targeted training on topics like sports, janitorial, and answer questions collected in between those sessions. And finally, public health officers are going to be available within your region to consult to school systems with any specific questions that you'll have. And so as we release this document, you will see that we also provide your public health region. We provide the contact information for your public health officer within that region, and certainly school leaders. We encourage you to go ahead and establish, if you have not already, a point of communication with your public health officer. And that will be an important contact to have as the school year, not only as you try to open, but throughout the course of the year, as you have questions about students who potentially may test positive or maybe symptomatic, or how do you handle in the event that school closure needs to be considered. So I would strongly suggest that you go ahead and make contact with your public health officer as soon as possible so that you can build that relationship. So I asked the question on Friday morning to Dr. BU and Dr. Guidry, and I said, look, I'm a former school principal and a former teacher. And so if you could just tell me a few things that I could really make sure that happened every single day, what would those things be, and tell me why they matter? And they said, well, that's pretty simple for us. One, have employees and students wash their hands frequently. Two, wear a face covering. And three, practice social distance. And so I will not go into the why behind each one of these areas. And I know there's a lot of public discussion about the effectiveness of all of these three things. But I can tell you that as I had conversation with these medical experts, I was fairly convinced myself that these three things really do have the potential to stop the spread of this virus and mitigate its impact within our schools. And so I would, to all extents possible, capture these three key principles, use them on posters, use them throughout your schools, use them in trainings, and encourage that they are happening in a structured way every day in your school system. So this is the first set of guidelines, and this is around group size. And as you can see at the top, they are based on the phases. So phase 1, phase 2, phase 3. You have a maximum group size for each of those phases. In phase 1, that's 10. We're currently in phase 2. We do hope that when the school years begin in August, that we are in phase 3, but right now we are in phase 2, and we'll be in phase 2 for 3 or 4 more weeks based on information out of the governor's office on yesterday. So you see maximum group size of 10, 25, and 50, dependent on the phase. Younger students, we're asking that you maintain static groups, understanding individuals may come into close contact and may not be wearing face coverings with younger groups. But as much as possible, keep a cohort of students, keep them together throughout their school day, and keep them in these static groups. Now, with older students, we were able, with the Department of Health, to not make the requirements as rigid. So we are saying if students are able to maintain physical distance, the group's composition may change. So for me, that's if you're talking about high school students who are changing classes, you know, we all recognize it's very difficult to maintain a static group in a traditional high school settings where students need various Carnegie courses in order to meet their graduation requirements. So what we were able to say with and get the Department of Health to agree with us is that the group's composition may change if we can keep that physical distance. And we're saying 6 feet of social distance to the maximum extent possible. So understanding that 6 feet of social distance may not always be possible based on the size of your classrooms, based on the size of your hallways. So we understand that 6 feet may not be possible. And so that's why we have in there to say to the maximum extent possible. So physical standards, groups convene indoors in rooms enclosed by walls or partitions. And if that's happening, that's where you'd want to make sure that you weren't exceeding your group sizes. High touch surfaces are cleaned before and after each group's use. Groups are separated outdoors, but do not require a physical barrier. Limit crowding at entry and exit points, maintain maximum group sizes and physical distance recommendations to the maximum extent possible. So when I think of that fourth bullet, and I think of high schools, high school principals at this point are going to have to consider what does a bell schedule look like, for instance, so that you don't have that crowding at those entrance points to and from various wings or hallways of the buildings. Athletics, you see phase 1 and 2 refrain from contact and high-risk sports, whereas in phase 3, contact and high-risk sports are allowable within the defined groups. And we are suggesting that everyone who has high schools in their system do look at the LHSA guidance that they have available for athletics during COVID-19. System monitoring, assess students on arrival and throughout the day, including conducting an initial temperature check. Establish an area that can be used to isolate sick students and clean and disinfect surfaces in the isolation area after the sick student has gone home. Environmental cleaning and personal hygiene. High-touch surfaces are cleaned multiple times throughout the day, including the bathrooms. Hand washing at arrival at least every 2 hours, before and after eating, before and after using outdoor play equipment, and at exit. When hand washing is not available with soap and water, we of course are recommending hand sanitizer. Adults and secondary students, 5th grade and up, as able, should wear a face covering to the maximal extent possible. Most importantly, at entry and exit and during transitions within the school building. Individuals with severe breathing difficulties should not wear face coverings. And so you see where we have 5th grade and up wearing a face covering. We decided to do a grade level instead of a specific age. For instance, you could have a student who is, for instance, 10 years old in 5th grade, but you could also have maybe a 9-year-old or an 11-year-old. And so we didn't want to say this is the age, because if you said this is the age, you could have a situation where some students in a classroom may not be required to wear a mask while others are. So instead, we said 5th grade and up. This is after hearing a lot of conversation around elementary students and the way that they understand and appreciate language development and movement of lips during language development, but also just concerns about would the mask with an elementary child prompt them to touch their face even more? And so with the support of the Department of Health, we were able to move that to 5th grade and up that should wear a face covering while in the buildings. Transportation, and this is no doubt the trickiest, one of the most difficult issues that we will all face. And so as you see, phase 1, 2, and 3, you need to understand the capacity of your school buses. What does that capacity look like? In phase 1, you're able to fill that bus at 25%. And if you go under that 25%, you see where it says school bus passengers ride 1 per seat with every other seat empty. However, members of the same household may sit in the same seat. So if we were in phase 1, buses would only be able to operate at 25%, but individuals of the same household can sit together. As you move to phase 2, that goes to 50% of your bus can be occupied, and in phase 3, that's 75%. I understand, trust me, the logistics behind how difficult this is for all of you, and how you're going to have to work with these regulations in order to find a way to make this possible. But in order to do this, the way to calculate, you take the number of the seats and multiply it by the percent of the manufacturer's capacity. This will give you the maximum number of people allowed on the bus at any given time. And we were also able to get the Department of Health blessing on only spacing and dispersing passengers to the maximum extent possible. So when you're in phase 2 and 3, so long as you stay within those percent capacity, those percent caps, then you don't have to have spaces between seats. You need to space the students to all extent possible within the bus and within those capacity limits. So that wraps up the guidelines. So those are the must-dos of things that you will need to do in order to open your schools. Next are best practices, and these best practices in the document that we have built and on the website that we are populating, we will have information on all of these different bullets and what these bullets mean, how you can utilize the information in these bullets, and what are best practices. So that would be strategies for how to physical distance, how to safely monitor symptoms among students and staff, and then respond to those symptoms. It will be information on personal hygiene and cleaning protocols, including use of face coverings, food preparation and meal service guidance, and then transportation, safety, hygiene, cleaning guidance, and other references. So as part of the broader effort to guide our systems in reopening, and at the request of the K-12 subgroup, we'll release a planning template and a survey. Questions relative to school opening that will be on that planning template and that we will be asking you to then in turn submit to the department include what will your plan be for instructional delivery. So we know what it will look like in the traditional setting, but we're going to need to know what is your hybrid model of instruction. So if you have to have a combination of on-site versus off-site, what does that look like, and how are you making that happen with students? And then also, if it moves to completely remote or completely distance education, how are you going to provide that education on that completely distance model? I know with the CARES money that we have really been able to get closer to one-to-one on our devices. I know with the CARES money, many systems have put in place or set aside funds to help support families or communities or neighborhoods with internet access. But I also am very aware that in some of our most rural areas, that even if you have a device and even if you have the funds to offer to connect to that device, that is still not an option. So that is a place where, one, we have to see what will it take to get access or connectivity in those places? Or two, what does distance education look like if a child is in that type of situation where they do not have connectivity? And you know, as a superintendent during the last school year, one of the things that we did was we passed out packets of instructional materials. But I think that going into this year with the time that we have leading up, just passing out a packet, that's not going to suffice. I mean, I think we have to figure out how do we then engage the student and the family over that packet, or what can we use in order to make sure that education happens. And this will not be easy, and this will be difficult, but it's our obligation. It's what we have to figure out how we can do this. So we'll also be asking what is your plan for alternate scheduling? What's the basis for that schedule? If you're providing virtual learning, what platforms are you going to use? What will your transportation system look like? How will you provide your student meals? Who's responsible for developing and overseeing environmental services? So that's disinfecting, cleaning, and then how will the school system communicate with families and the employees? And so whenever we're talking about communication at this point, I think it's going to be really important that you begin developing a plan of how you're going to communicate your reopening plan to your public, which includes your general public, your community, but also and specifically your parents. Because while the department is providing you with a general framework, guidelines, and best practices, every individual system is going to have to take this information and develop their own plans for having school. And having been in many of your seats, I know that parents are going to have questions about this, and parents are going to be understandably concerned about schooling during COVID. And so the more that we can communicate with our parents and our community, the better off that we're going to be. And us gathering this information is not just gathering information for the sake of gathering information. I know how that can look. I've been there. But we're going to have to provide information to our Bessie, for instance, but also to legislators who are going to be asking me questions every day about reopening and how the school year is going, as well as the governor's office, but also external groups. And so us being able to have this information will be able to help policymakers with decisions that they may have to make as the year progresses. But also it's important for you to submit this information, I think, because we have access to some of the public health experts and some of the experts in some of these different areas. And we can in turn provide you assistance if we know what it is that you're trying to accomplish. So that's one of the reasons we're going to be asking you to submit this planning template survey. So then, you know, one of the most pressing questions has to be, what if a student in a school, or you could substitute an employee in a school, tests positive for COVID-19? What do you do? So here is that graphic on what you have to do. If you become aware of a positive or presumptive positive case, contact your regional medical director. The regional medical director will advise on communication, quarantining practices, enhanced cleaning or disinfection processes, or school facility closure. Then let's go to bullet 2 here. You may be contacted by an LDH contact tracer who will conduct contact tracing activities, including school-based contacts. Students whom may have been exposed to the individuals that tested positive, who were less than 6 feet away for more than a 15-minute time period, need to be isolated at home for 2 weeks. This will be determined by the tracer in consultation with the regional medical director. You may be asked to send a parent letter home indicating there has been a positive case. This decision should be made in consultation with the regional medical director. Now, the Louisiana Department of Health, from my base of understanding, it is not suggesting that if there is a positive case in the school that the just as an automatic trigger that the entire school be closed down. That is not what they are suggesting. And so this is why it's important, leaders on the phone, that you go ahead and establish these relationships with the regional medical director. For instance, so as a district superintendent, there were times when we would have a flu outbreak in some of our schools. And so there would be questions about, should the school be closed? And you would possibly get feedback or opinions on that from parents or Facebook or in other places. But you may have had a protocol in place where if the school had 10% of the school was out sick, then you would close the facility. Maybe it was 20. Those were local decisions. And so I think it would be good to start thinking through what does that look like at your district level in conjunction with your regional medical director around school closure. You see at the bottom, it has parent letter. That will be a link, and that will be available on our website. We're going to try and provide as many resources as we can for you of, hey, I need to send this parent letter because this happened. Let me pull up this sample letter from the department. And so if we know these examples of things that you might need, we're happy to populate our website with examples to help you out and support you through this. But this is the 1-2 step process of what happens if a student tests positive. And basically it starts with that contact with your regional medical director. Thank you, Mr. Bradford. I see that we have questions and answers, and I think Dr. Welch is still on the call.
Yes, thank you, Dr. Brumley. We will now transition into our question and answer session. We've had several questions come into the group chat. So what I will do is I have been grouping like questions, and I will pose them back both to you, Dr. Brumley, and Dr. Welch for responses. So Dr. Welch, one of the questions that has come in is in the guidance, it references younger students and older students. And also related to that is the question about wearing face coverings. And in this instance, fifth graders, if there's a school that is configured grade K through 5, is there flexibility around just having fifth graders wear masks? So if you could just provide some clarity around what they should be thinking in terms of considerations for younger students versus older students, and then speak to the mask wearing of fifth graders and above.
Absolutely. And so it's an important point, and I think it's been made several times. To the extent possible, we're fully aware that younger children typically can't wear masks, or wearing a mask is not as plausible or realistic as we'd like it to be. Therefore, we kind of set a cutoff, as was mentioned by Dr. Brumley, that fifth grade and up could wear a mask. However, if you have a specific situation, and again, there may be situations where younger children would want to or are able to wear a mask, or there may be children with breathing difficulties that cannot wear a mask. That's just a general recommendation that in your planning as you move forward, you'll want to consider. Ken?
Thank you, Dr. Welch. Could you speak to the temperature checks? I know when we were in phase 1 at one point, there was the bus transportation was going to take a temperature check when getting on the bus. Now we have the guidance about upon entering the school, there's to be a temperature check, but we're getting some questions about if students were to do a grab and go lunch in the food court, socially distanced, could they walk on their way to a homeroom, get a socially distanced grab and go lunch, and then the homeroom teacher provide the temperature check?
Yes, and again, Ken, it's really going to depend on the school. At a small school, you could probably do temperature checks upon entry. At a much larger school, that's going to make children cluster all together before they get a temperature check. So it would be much more advisable in that particular situation to have temperature checks as they enter the homeroom. So again, in your planning for the fall, based on your local needs in your local school, you'll make these decisions based on what's best for your school. And so in the example that's given, the one caution I would give is that, doing temperature checks after children have been outside, say doing some sort of physical activity in the sun, doing a temperature check right after that probably isn't a great idea. So you also have to recognize the situation that you're in and the climate conditions and also what's best for your school. In a larger school, I'm going to recommend that that's done at the homeroom rather than the entrance.
Thank you. We've had questions come in about will today's PowerPoint and today's session be recorded? And the answer is yes. Today's recorded session, it will be posted to the website as well as the PowerPoint. We will do this with the release of the documents. So I'm going to ask now for Dr. Brumley to just speak briefly on the timeline for releasing the full set of guidelines and the best practices documents. And then Dr. Brumley, if you could also just speak to where we are relative to regulatory flexibilities. We're getting questions about instructional minutes and compulsory attendance.
Yeah, thank you. So we will release this full document sometime probably tomorrow afternoon. That would be Wednesday afternoon. And we certainly want to have that out in advance because Thursday evening, I've been asked to testify in Senate Education Committee about reopening plans. So our intent is to have this out by Wednesday afternoon, probably at the latest. But Ken, I would also suggest that this will be an evolving document, and even the website will be populated with information as we have things available or as we learn of best practices or as we get a frequently asked question. So this is not a situation that we're handing this out and it's over. It's something that we will continue to work through and try to make better. I too have heard the question many times about compulsory attendance, instructional minutes, and even accountability. And at this point, all I can share would be that at this time, current laws and policies relative to compulsory attendance, instructional minutes, and state assessments remain in place. However, we will continue to monitor the pandemic and address any necessary regulatory flexibilities at the appropriate time. I've had this same conversations with members of BESI, and we believe that at this point we will keep current rules in place, but obviously recognize that if there is a shift or if there is a legitimate need, that would certainly be something that we would need to look into.
Thank you, Dr. Brumley. Dr. Welch, can you speak to the face coverings relative to what is an appropriate face covering? I guess there's some different types, to the extreme of a full mask, but then also some of the coverings that you can be wearing on the neck and pull up. And then with the face coverings, should this be viewed as like a school uniform where it could be washed and reused every couple of days or something along those lines?
Ken, yeah, we get a lot of questions about that, especially given that at the beginning of the pandemic, we weren't recommending people wear face masks. And people normally understand that, or the initial preconception is, will this mask protect me from getting coronavirus? And we've seen pretty frequently that not only with coronavirus, but other respiratory diseases, wearing a face mask really does not protect you all that much from getting the disease. We just have too much hand-to-face behavior. A cloth mask certainly doesn't protect people from not touching their face or things like that. But what we have found significantly with coronavirus, especially given that there's a significant number of people who have asymptomatic disease or very low-level disease, like they just have a very mild cold or a runny nose, but they are still able to spread coronavirus, those people, when they wear a mask, even just a cloth face mask, it significantly reduces the ability of that person to spread it to other people. So just in real simply, cloth face mask, perfectly appropriate. Yes, the kind that is reusable and rewashable, absolutely effective, or the daily kind that you throw away at the end of the day. I just would say that those daily kind, you do not wear more than one day, but a cloth one you can wash and reuse.
Thank you. The next question is about food and nutrition and students eating. And I know that as a best practice, there was some discussion relative to students actually eating in their classroom, remaining in their classroom, socially distanced to the maximum extent possible. For those school systems that do need to leverage their cafeterias or their atriums to feed students, could you share what the social distancing and the best practices should be in that eating in that environment for students?
Yes, absolutely, Ken. And it's really the same thing as we do for the group sizes as well. We really do want students to stay 6 feet away from each other. We do recognize that food service is an integral part of the learning environment, and making sure that activity continues is really important. So what we're asking the school systems to do is be creative and innovative. If you can stagger eating times, please try and do so. If you can expand the areas by which students can eat, that would be great as well. Also, making sure that you clean before and after the student eats there. And then again, the most important thing is, especially eating, you can't wear a face mask when you're eating. Making sure that people are at least 6 feet apart when they are eating. And the only exception to that is family groups can sit together.
Thank you. Questions relative to the regional medical directors. Number one is, are they also serving private schools and non-public schools, and to provide consultation? And then number two would be relative to that. Superintendent Brumley shared that's forthcoming in the guidance about what are the steps if they have a positive test for COVID-19, which is to reach out to the regional medical director. Could you speak to so I guess it would be good if you could just speak to the role of the regional medical directors, knowing that we have published this on the website in April, all the 9 regions and the contacts, but
yeah,
the role of the regional medical directors.
Yes, so I've had some feedback from that as well. Again, what the regional medical director's role, both for private and public schools, is in consultation with the schools in planning. As they move forward with planning for the fall, make sure they have systems in place and understandings in place. A lot of schools have school nurse facilities. It will not be necessary for every single case of coronavirus to be reported to the regional medical director. But in your planning, what you want to do with the regional medical director is make sure you plan for cases and how those are going to be dealt with, so that when it does happen, there will be a system in place to deal with that, in consultation with the student health center, with the student nurse. And then again, the same thing is going to apply to when we talk about things like school closures. Again, that's going to be a partnership between the regional medical director and the Office of Public Health. And that's part of the reason for the webinar, is so that you all can get together and plan for these things. You have several months before the school goes into place. So what we want you to do in consultation with the regional medical director is plan with them and plan for these events. And certainly we're not dictating every single situation. Just what happens if this happens is what we want you to do in consultation with them.
Thank you. In the New Orleans area, students, it's common for some students to ride the public transit system with using a token to get to their education facility. Can you speak to considerations that students should have that are going to have to ride public transportation outside of a school system bus?
Absolutely. So in that particular situation, we're asking that the student follow the same guidance. although because there is guidance for public transportation as well. Currently, public transportation, it's recommended that it be at 50%. So I would simply ask the student to follow those same considerations. Don't sit in seats with close to other people. Wear your face mask. I know a lot of city transportation are following our guidance where you crack the windows. And so kind of follow the same procedure that student would on a school bus, but just do it to a public bus when they're on it.
Thank you. I'll actually address the next question, and that's a question about when we are, as a school system, if we are conducting distance education, remote learning, how do we count the instructional minutes and how is attendance taken? And what we will do is we will put in the FAQ document, we will outline the instructional minute requirements as well as the compulsory attendance requirements, and provide you examples of how that is accomplished. And I would just say, as an example, for a high school credit, which has, approximately 7,800 instructional minutes tied to that Carnegie unit, school systems would think of this as, if my student is working virtually or remotely, they would have 7,800 minutes worth of work. And whether that's live teacher instruction, whether that work is watching video discussions, whether that student is completing, a worksheet, they should think of it in those terms. But those, we've had a few of those questions come into the chat. So as part of our FAQ document, we will provide, further guidance around that compulsory attendance requirement and the instructional minute requirement. Dr. Wiltz, I want to come back to you on the temperature checks. And perhaps I had confused some folks when I referenced the buses, but I know at one point early on in the summer, when we were talking about summer camps and things of that nature, there was some early discussions about temperature checks being required upon a student getting on a bus. And I believe that has been relaxed now across all of the phases, 1, 2, and 3, such that the intent of it is, as soon as the student gets to school, they get the temperature check. So if you don't mind, could you just come back to the requirement of the temperature check for entering school? And then also, are the regional medical directors an entity that could help school systems in determining which type of thermometers and devices they should be using for temperatures? Because this seems to be quite a few questions around digital thermometers or scan thermometers, with some of the technology.
So Ken, the first one in dealing with the temperature checks, the challenge we had, as you remember, with temperature checks and the buses, what we really want to do is make sure that temperature check is conducted in a safe and a proper environment in order to get an accurate temperature. And when we had phase 1, getting on the bus it did not work well. And so for lots of different reasons that many of you know about. What we want people to do is, after students arrive at the school, at the first available opportunity, without being overly prescriptive about it, making sure that students are still following those general rules, like social distancing, like if they're able to wear a mask, making sure that they've washed their hands. The first place that is logically practical to conduct that temperature check, for example, you wouldn't want to have 60 kids standing out in the sun and then check them as they come in. At a smaller school, you could have them come into an area, wait single file, where it's shaded at least, and then check their temperatures as they come in. For a much larger school, again, it's not practical to do that as students arrive. We would much rather have that done right as soon as they get to school, but as they get to their homeroom class would be more practical. I would not say that the regional medical directors are the resource for thermometer recommendations. I would say that would be me and my partner from Children's Hospital, Dr. Finger, who has worked with us this entire time what I'd like to do, Ken, is put together like a little fact sheet or FAQ about what to look for in a touchless thermometer, and we'd be glad to include that in the planning packet.
Thank you, Dr. Welch. Yeah, I'm getting several questions about just clarifying when will this presentation and the resources be available. And so, yes, we will. This recorded presentation will be available. The plan is for this to be available tomorrow, as well as the presentation, the PowerPoint presentation. We will release both of those tomorrow when we do the release of the guidance and the best practices. We've also been asked, will there be another session like this? And the answer is yes. We have June 30th blocked off now, where we will do basically the same presentation again on June 30th. Also, questions coming in about the FAQ document. I would say that what we have done since COVID-19 in mid-March is we have had a dynamic FAQ document relative to overall COVID-19 that we have updated very, very frequently. It's our same intent to do that. We are going to have a dedicated school reopening dynamic FAQ document. I think, like Dr. Welch, yours is a good example. When school systems ask us, how can we get technical advice on thermometers? This would be an example of something that we will put in the FAQ. Envision this will go up by the end of the week. We will have the first rendition of that up, and then we will, from that point forward, we will continue to keep it updated. I do want to do two more things. I know we're getting close on time. First is Dr. Welch, if you could come back to the transportation and what we have in the guidelines, just for clarity, is the 50% is 50% for phase 2, as an example, is 50% of the manufacturer's passenger load. So if you have a bus in phase 2 that can hold 72 students, then in phase 2, you could have 36 on the bus, socially distanced to the maximum extent possible. We do recommend, and it's recommended, that students sanitize hands upon getting on the bus, and that windows are kept down for ventilation. So, Dr. Welch, can you speak to, if it rains and windows have to be closed, what considerations should be made? And should all students be wearing a mask if they're riding a bus, given that the guidance is not recommended? The guidance that started with a recommendation in fifth grade. So should kindergarten through fourth graders at least be wearing the mask on the bus? And then what do we do if it's raining and windows can't go down?
So thanks for that, Ken. So in the rare event that it's raining, again, you can still crack a window theoretically, but again, I think our guidance states that we want you to open the windows to the extent possible. There are going to be situations where it's not possible to open the windows, and so in that situation, you're just not going to be able to. Again, the buses are going to be cleaned before and after use, and yes, we do recommend masks, but again, not for the younger children. Again, it tends to be worse, make things worse rather than better. So we want to stay consistent throughout the day. So those older children, we will want to wear a mask, and we will want them to wear the mask on the bus. The younger children, again, social distance, windows open, washing hands, cleaning the bus before and after.
Thank you, Dr. Welch. I know we're up on time. I know Dr. Finger joined us from Children's Hospital, New Orleans. And just before we close, Dr. Finger, just both to you and Dr. Welch, I want to thank you for everything that you have done to help us with this guidance. And Dr. Finger, before we close, just do you want to say a couple of words from the perspective of Children's Hospital? And I know you've worked extensively with pediatrics.
No, thank you. And thank you, Dr. Welch, also for the kind words. It's been a pleasure working with the Department of Education and the Department of Health over the last several weeks in order to maximize the safety of our children and all team members who work with our children in the school systems across the state. I look forward to Children's Hospital being an ongoing resource for local schools as well as regions whenever questions come up, whether they're about specific students or helping to fine-tune policies and procedures as we move forward. So thank you for inviting us to this introductory town hall. Look forward to participating next week as well. Thanks a lot, Ken.
Thank you. Dr. Welch or Dr. Brumley, any closing comments?
Ken, I would just like to thank everyone for being on the call. I recognize that systems and schools are going to have to take the information and develop a plan that makes sense for them. I also understand that systems may have schools that are large or small or intermediate and of different configurations. And so that the way that plan develops could look even different within a school system based on the various setups. So we will do our best to try to keep a website of resources available, and certainly we'll be here to answer any questions that come up. But I just thank everyone for being on the call, and I appreciate everyone's efforts as they work. And I know everyone wants to make this happen. So just let us be a resource for that as necessary. So thanks, Ken.
Anything, Dr. Welch?
Just thanks to everybody, and I look forward to working with you in the future and developing that FAQ. I know my partner, Dr. Finger at Children's Hospital, and my partners at LDOE are looking forward to making the FAQ document and making it something that's useful for you all as we plan for the fall.
Okay, well, this will bring closure to our first webinar. Just next steps, look tomorrow for a release of the guidelines, a release of the best practices, the posting of today's recorded webinar, the posting of today's PowerPoint presentation, and we will begin working on that FAQ document. Some of the questions that we may not have gotten to today that were very granular in the weeds, we will certainly include those on our FAQs. And we will have a subsequent webinar to this. The next one is scheduled for June 30th. Thank you, everybody, for joining. Have a good afternoon.